The other students will join us later. And here we are. And let us move it, make it full screen. And as you see, today we are going to continue speaking about general practice and people working in general practice. And first, I would like to say some words on the home assignment that you've done for this class. I mean that you were given the task to write the essay, which answers the question, is there a difference in working in city, urban, and rural areas in your home country? So the essay about which compares living in a city and living in rural areas. Well, I've read a lot of just essays, and generally I like them, but there are some comments about, for example, the form of the essay. You should have divided the essay into several paragraphs, because each paragraph should say should present only about one idea, and the proof, the support for this idea, like examples that illustrate this idea. And if you write about a different idea, you should give it in another paragraph, in the next paragraph. So one paragraph, one idea. So if you have several ideas, you should have several paragraphs. Well, and about the structure of the essay, it should have the introduction, the body, and conclusion. So introduction, this is in the introduction you say what you are going to write about. You just present the topic of the essay. In the body there can be several paragraphs depending on the number of ideas. And in the conclusion you summarize what you have written in the main body of the essay. So to give your opinion or to summarize what you've said. Well, and also there are some comments on the language that you've used in the essay. I mean that you shouldn't contract the words in written work. I mean, when we speak in the conversation, just in the conversation, we can contract the word, use shortened forms, but here we should write not like you are getting, but you are getting. Or, for example, some of the students wrote like NO of people, which I guess stands for number of people. So you should be careful with this and write the full form of the phrase. And there were some typical mistakes that I've faced in I came across in your essays. I hope that they are just mistakes because sometimes we are not careful about what we are writing. Now let us analyze what kind of mistakes we have here on this slide. There are some phrases and sentences. Let us read them and decide what's wrong with these phrases and sentences. So, Aman, please, the first phrase is for you.
Ma'am, like people don't believe in.
Yes, instead of does, we need do, don't, because people, it doesn't have the final S, but it is still the plural form, we remember. One person, many people. And with plural form, we use do in the present simple tense. The second sentence is for Apeksha. Are you here?
Yes, ma'am. Yes, ma'am.
Read it, please.
Doctors in urban areas are usually more educated than in rural areas.
What's
Find any mistake in this.
what's wrong here? What's wrong with this sentence?
Generally more educated. Maybe.
This is just grammar form, the form of a word. Who is the most just attentive person? When we compare two things, doctors who work in urban areas and doctors who work in rural areas, we say more educated. Which word should we use?
Better educated.
And
Yes, then. Instead of then, we should use then, because then means, so first I did something and then I did another thing. Here, this is only one letter matters. So the next is for Misha, please. Misha?
It creates a wider scope for the treatment of the treatment. Not it is not possible for the treatment.
What's wrong here? Do you mean
It
not?
creates wider scope of treatment. It shouldn't be of. It should be for the treatment.
Mhm.
It is not possible that of it is the specific. It is that it is the only treatment which can be done. There are variety of the treatments which are possible for the diagnosis of a particular disease.
I think treatment here has a general meaning, any kind of treatment. And as far as this is not countable, we can't use a treatment. Yes, it's uncountable.
Not at, it's for wider scope for the treatment.
What about the use of, what about the verb here?
Create
Is it all right? I mean, is it correct? What is the tense form here? What is it called?
this is present tense.
Present simple, and in present simple,
Present tense.
when we speak about third person singular, we need to add what? Like do, does.
It will create or it creates.
Creates.
I said creates.
Okay.
It creates a wider scope for the treatment or of the treatment.
So the next is for Nivas. Are you here? Is Nivas here? Ram Nivas? No, Nivas minus. Okay. Vandana,
Yes, ma'am.
read it, please.
The special opinion in choosing the workplace.
Where's the mistake here?
The correction must be the special experience.
Let's have a look at the form of the verb here. Where's the verb? Yes, Priyash.
ma'am, it will be an opinion,
And
first of all.
yes, and
Specialty field creates money and an opinion in choosing the workplace.
you're right. So here are the highlighted mistakes, and here are the correct forms. Okay. And I would also say something about the problem that sometimes students have. This is plagiarism. And so actually when you write something in your essay and you say, I think that, it means that you just express your opinion and you say something from your experience, what you know, And but when you say, for example, that there are about 75% of people live in urban area, and so 25 in rural areas. Have you calculated this percentage yourself, or have you done any research yourself? Of course, no. You use the information which you have taken from the internet, from different sources, right? You've read it somewhere. So when this is considered to be plagiarism, because plagiarism means writing ideas from any source and not acknowledging that source. And in other words, to plagiarize is to use another person's words and pretend that they are your own words. And we should just avoid this. We should give a link to, we should mention where we've taken the information from. You may copy work, but you must show your reader that it is copied. This is not your own idea. Well, and there are some examples of plagiarism, and this is like not only plagiarism, this is cheating when students just copy somebody's paper. Even here, when I read the essays, I feel that I've already read this in one of the essays, and I've already seen this title underlined the same way. So in another paper, student's paper, or like here also the students didn't think about changing something. They've just copied the ideas from another paper, and they have even just copied the design of the paper of another student. So of course this is bad. You shouldn't do this. And if we speak about avoiding plagiarism, so how should we do this? This is one of the ways is paraphrasing. So to paraphrase is to include the ideas or information from the original source in your paper by rephrasing those ideas in your own words. It works like this. You read something on the internet, you like this idea, but you should put aside the text, and you should rewrite it, paraphrase in your own words, using synonyms or changing the structure of the sentence. So this is the way to avoid plagiarism. But of course, you should give the link to the source of information. For example, if it's this is some official information taken from official site, some data that you obtained from some official sites or from other people, if you speak about a specific series. Well, is it clear about plagiarism? Mm-hmm. And I don't like just catching students because I mean with this cheating. So I feel upset. It's so sad for me. Yeah. Now let's go back to what we were speaking about at our previous classes about people working in general practice. And today we'll start with the listening task. So, and when a doctor writes a case history, and we are going to listen to the conversation between two people. One of them is Mr. Bloomfield. He's 20 years old, and he is a civil servant. And another person is general practitioner, GP, Dr. Dixon. He is a locum GP. And we should discuss why the past medical history, family history personal and social history and drugs and allergy history are important. First of all, I would like you to focus on some phrases which we need to make sure that we understand everything the right way. I mean that, so about Mr. Bloomfield, a civil servant, he works as a civil servant. So civil servant, you remember, this is an employee of the government, like a teacher or a doctor. So people who get their money from government. And locum GP. Locum GP, so this is general practitioner who stands in for another doctor who is temporarily ill or on holiday, away on holiday or off sick. So he is working instead of another doctor. Dr. Dixon is working. And here there is the page with the doctor's notes about which he has made after he talked to his patient, Mr. Bloomfield, yes. And to the right, there are also some words which you should focus just to remember their meaning: contributory, helping to cause, precipitants. This is a noun. Precipitants are factors which cause something. The factors which go before something happened. And of course, you know, siblings, they are brothers and sisters. If we look at the notes, which are given on this slide, this is a case history. So you see that there are several abbreviations here. And so the first one is underlined here is PC. Do we remember the meaning of these letters? What do they stand for, PC? Is it personal computer?
Yes, ma'am.
No, it isn't. It should be connected with the so patient, like his disease. You remember when we were speaking about when a patient comes to a doctor and he has some problems, what does a patient say? He says, "Oh, well, doctor, it hurts me. So I can't bend, I can't walk. It hurts so much." So what does he say? These kind of things.
About his pain in the area.
And he says, "Doctor, help me. I need your help." So the pain is so severe, so hard. This is done in the form of a complaint, right? He complains. So
Patient complaint.
Sure, this is not patient, but this is presenting complaint.
Okay.
This is the term we were speaking about, presenting complaint. Okay, and HPC, what does it mean? This is what happened before. History, yes?
History presenting complaint.
Of presenting complaint. And here, this is post-medical history, PMH, post-medical history and family history, okay? Well, and you see that there are several gaps here in these notes, in these phrases, and our task is to listen to the information, to the conversation, and to complete the gaps with the words which were used by the doctor and the patient. So we are going to do this, and I will switch on the recording and you'll tell me if you hear or not. Okay.
Listening to
We can hear.
Good morning, Mr. Bloomfield. My name's Dr. Dixon. I'm a locum GP standing in for Dr. Wright. What can we do for you?
I've been having some problems with my breathing.
Can you tell me a little bit more about this?
Well, I keep getting breathlessness and wheezing in my chest. It all started about 3 weeks ago, and I've been coughing a lot with it. Some white phlegm. I thought it might be a cold coming on, but then after about another week, I started finding it more and more difficult to catch my breath.
Right. So you've had the wheezing and the breathlessness for roughly 3 weeks.
Yes, give or take a day.
And do you get these bouts of wheezing and shortness of breath every day?
No, they come and go.
How frequently do you get them?
The first week there was only one, I think, and then they started getting worse, 3-4 times a week. It's not being able to get my breath that's really worrying.
And so the attacks, have they increased in the past 2 weeks?
Yes, they're much more frequent.
Okay. When do the attacks come on?
At any time, but they seem to be worse at night and in the morning.
Have you noticed any change in the severity of the attacks, especially in the morning?
Yeah,
Do they wake you up at night?
about 3 times a week.
I see. You been off work at all?
No, but I nearly didn't go in yesterday.
Was that the worst so far?
Yeah.
And have you had anything else with it?
I've felt a bit tight across the chest.
Any pain with it?
No, just tightness.
Are you aware of anything that triggers the attacks?
Like what?
Dust, feathers, new carpets?
No, I can't really say I am.
Okay. Have you had any infections recently, like flu or sore throat or chest infection?
No, not for a long time, except this.
And what about medications? Are you taking anything?
No,
No aspirin?
no,
Are you doing any exercise? Jogging, for instance?
no.
What about pets? Do you have pets at home?
No, but my neighbours have a cat, but I don't see it that much.
Everything okay at home?
Yeah, things are fine.
And what about work? I see you're a civil servant. Any stress or problems at work or anything like that?
Work's been getting me down recently.
In what way?
Well, there's been a lot of changes going on recently, and I suppose I'm a bit anxious, what with the mortgage and that.
And this has been getting to you?
Yes, more and more.
I see. And does the wheezing, etc., continue over the weekends?
No. When I come to think about it, it doesn't.
Okay. Some general questions. Have you ever had anything like this before?
No, never.
Do you have other illnesses? High blood pressure, diabetes, or heart problems?
No, nothing like that. This is the first time I've been ill in my life.
Has anyone in your family had anything similar?
No, not as far as I know.
What about eczema? Anyone in your family with that?
Both my sister and my mother have it.
Well, you see how the doctor keeps asking questions about the details of the patient's condition because he needs to find out everything all just to be able to speak about diagnosis. Well, let us look at the first section of this case history. This is presenting complaint, and let us listen to Priyesh.
Yes, ma'am.
Am I right in that Priyesh is your name, your first name? Yes.
Yes, ma'am. Priyesh is my first name and Bhardwaj is my title.
I see. So what is missing in the first part in the presenting complaint section? 1, 2, 3, 4.
Ma'am, 4 points.
I mean, which words are missing here?
Ma'am, his symptoms are missing over here, ma'am. The symptoms he faced.
For example?
Ma'am, I couldn't hear the first part actually due to network issues. I mean, it was going and coming.
Mhm.
That's why I was not in the hole. But I heard that his brother, his sister and mother are having eczema, and
Okay.
he doesn't have any diabetes, and he fell for ill for the first time. I
Uh-huh.
missed a few points, but I think that these
Just
are
a
the
minute,
one which
just
you're
a minute.
asking right now.
If you've missed some points, are they,
No, no.
I mean, what about the other students? Shall we listen for the second time just to be sure that we understand everything?
Yes, ma'am.
Yes,
We can
ma'am.
listen.
Okay, let us
Ma'am,
listen.
actually, it was fluctuating, ma'am. We could hear sometime and we couldn't hear sometime.
I see, okay. I'm switching on the recording for the second time, and you say if you hear or not.
Listening to.
Okay?
Good morning, Mr. Bloomfield. My name's Dr. Dixon. I'm a locum GP standing in for.
Sorry.
Yes, ma'am. See, it went again.
Dr. Wright. What can we do for you?
I've been having some problems with my breathing.
Can you tell me a little bit more about this?
Well, I keep getting breathlessness and wheezing in my chest. It all started about 3 weeks ago, and I've been coughing a lot with it. Some white phlegm. I thought it might be a cold coming on, but then after about another week, I started finding it more and more difficult to catch my breath.
Right. So you've had the wheezing and the breathlessness for roughly 3 weeks.
Yes, give or take a day.
And do you get these bouts of wheezing and shortness of breath every day?
No, they come and go.
How frequently do you get them?
The first week there was only one, I think, and then they started getting worse, 3-4 times a week. It's not being able to get my breath that's really worrying.
And so the attacks, have they increased in the past 2 weeks?
Yes, they're much more frequent.
Okay. When do the attacks come on?
At any time, but they seem to be worse at night and in the morning.
Have you noticed any change in the severity of the attacks, especially in the morning?
Yeah,
Do they wake you up at night?
about 3 times a week.
I see. You been off work at all?
No, but I nearly didn't go in yesterday.
Was that the worst so far?
Yeah.
And have you had anything else with it?
I've felt a bit tight across the chest.
Any pain with it?
No, just tightness.
Are you aware of anything that triggers the attacks?
Like what?
Dust, feathers, new carpets?
No, I can't really say I am.
Okay. Have you had any infections recently, like flu or sore throat or chest infection?
No, not for a long time, except this.
And what about medications? Are you taking anything?
No,
No aspirin?
no,
Are you doing any exercise? Jogging, for instance?
no.
What about pets? Do you have pets at home?
No, but my neighbours have a cat, but I don't see it that much.
Everything okay at home?
Yeah, things are fine.
And what about work? I see you're a civil servant. Any stress or problems at work or anything like that?
Work's been getting me down recently.
In what way?
Well, there's been a lot of changes going on recently, and I suppose I'm a bit anxious, what with the mortgage and that.
And this has been getting to you?
Yes, more and more.
I see. And does the wheezing, etc., continue over the weekends?
No. When I come to think about it, it doesn't.
Okay. Some general questions. Have you ever had anything like this before?
No, never.
Do you have other illnesses? High blood pressure, diabetes, or heart problems?
No, nothing like that. This is the first time I've been ill in my life.
Has anyone in your family had anything similar?
No, not as far as I know.
What about eczema? Anyone in your family with that?
Both my sister and my mother have it.
Well, so Priyesh, have you heard what is missing here?
Yes, ma'am. Yes,
What is-
ma'am. Yes, ma'am. He was feeling he was actually feeling he was getting wheezing, wheezes and wheezing, and then he was continuously coughing. The last one, fourth one will be white flame.
Yes,
And
thank you.
about this
Yes.
productive one, I couldn't catch what exactly he's talking about productive.
Which productive coughing, because it products
Productive.
white phlegm.
Okay, ma'am. That's it.
So thank you, and let us move to history of presenting complaint and listen to Rakhov. Rakhov, are you with us? No, Yadav Rakhov is absent. Ujval. Ujval, are you here? No, Ujval. Sayonika?
Ma'am, his internet was weak actually.
Sorry, who's coming?
Ma'am, Ujjwal's internet is weak, so his voice is not coming, but he's saying something. He'll come back later
Mhm.
when his internet problem will be resolved. He's in the meeting, but he'll come later.
I see, thank you. Sayonika, please. So what is missing in starting with 5 up to 10? Is Sayonika with us? No. Roy Rohit?
Yes, ma'am. Yes, ma'am, I'm here.
Number 5. What is here, number 5? This is about the time when attacks happen and get worse.
Yes, ma'am. It's ma'am, mainly at night and ma'am, some in morning.
Right.
And ma'am, it's usually ma'am, three times a week, ma'am.
Okay. And what about the other symptoms, like chest? What kind of condition is it? Is it the other symptoms? Number 8. Chest what?
What would I say?
Who can help us with number 8? Yes.
Chest tightness.
Can I?
Chest tightness.
Tightness. Number 9.
Yes.
And number 10.
Ma'am, no allergic
No,
precipitants.
Yes, ma'am.
No known precipitants, and history
known, okay.
suggests what?
no infections.
No
No
medications.
infection.
No medications and no
history of
infections.
any
No medications.
illnesses and
No antigens.
no exercise.
Okay, but history suggests here we should speak about the possible diagnosis here. What is it? It can be
Lung infection.
infection,
Wheezing.
no infection.
No.
Ma'am, history suggests that he
There
is
is no
having
infection
a stress
in the past.
in his civil
Amma.
work. Ma'am, history suggests that he's having some stress in the job which he's
Anxious,
doing in
yes,
civil
he's
services.
anxious.
So he's having an anxiety attacks.
Okay.
In the night and in the
Yes.
morning it is severe, and it is getting worsened 3 to 4 times a week now.
I mean that the diagnosis, is it just anxiety attacks, or is it
It
something?
may look like emphysema too, because since he's working and he's having some changes in his workplace, that may also cause him wheezing and coughing. Yeah, just a possibility, but yeah, emphysema can also be there.
Mhm. Well, so, and we missed.
Mother and sister
When he
was
was-
in
He was speaking about, the doctor asked him about his family members, mother and sister. What do they have?
Ma'am, asthma, ma'am, they both have, ma'am.
No.
Means mother.
Mother and sister
Mother and
is
sister
eczema.
both are.
Number 12 is what?
Eczema. Eczema.
Eczema.
Eczema, ma'am. Eczema.
Eczema.
And mother and sister have eczema.
And so as for number 10, so they can be also like eczema or differential.
No history, ma'am. No history for the patient.
I see. It can be also asthma. Yes. These are the symptoms of this disease. Well,
Listening to
go to the next page, next slide here, and here So we should speak about symptoms and signs that show that the disease that the patient is ill with. I mean that there is a difference when we speak about signs of a disease and symptoms. So a sign is something that the doctor sees. It's an indication of illness that the doctor sees, but which is not apparent to the patient. So it's obvious to the doctor, but it's not seen to the patient. And the symptom is like a stronger evidence, and this is what the patient notices himself or herself. So sometimes signs can be classed as symptoms and vice versa. Sometimes we can't differentiate between them, but normally we speak about what is visible to a doctor is a sign, and what is visible to a patient is a symptom. Well, unfortunately, we have, yes, only 1 minute left, as you see, and we should stop. Just a minute. And we